Committee of the Whole is called to order. My colleagues, at the request of the body, for GMH officials here and public health, we have of us Ms. Posadas, the administrator of Guam Memorial Hospital Authority. We have Director Art Sinoxine. I'll have them introduce their staff. But with that, notwithstanding the rules of engagement, the rules for this panel will be 1 round of 5 minutes per senator. Yielding of your time is allowed to only one senator. The senator receiving the time may not yield the remaining time to another senator. For this panel, only questions may be asked of the amendments or in general related to GMH. Discussion and further action on the amendment will be made upon the dismissal of the panelists. I'd ask now the Sergeant Arms to swear in the panel, and I ask them to rise. Sergeant Arms.
Please raise your right hand. Under penalty of perjury, do you all affirm that any and all information you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth, so help you God? Mr. Chair, under oath.
Thank you very much, Sergeant Arms. My colleagues, the panels are aware of the amendments that have been proffered, and I ask them to maybe speak in specific or in general about what may impact them or assist them in their mission. I will begin with Ms. Posadas, and she can introduce her staff that's here. Ms. Posadas?
Thank you, Senator San Augustine. Yes, my name is Lillian Posadas. To my left is Mr. William Candu, who is the Associate Administrator of Operations. To his left is Ms. Yuka Hachanova. She is our Chief Financial Officer. Thank you.
Thank you. Mr. San Augustine?
Good afternoon, Senator San Augustine. I'm Arthur San Augustine. I'm the Director of Public Health and Social Services. With me this afternoon, I have Mr. Vince Uggan. He is the Acting Chief Public Health Officer. And if it is permissible, we also have Ms. Zenia Piscina on our phone. She's listening in if that's permissible. And so she's also with Public Health and Social Services. Thank you.
All right, thank you. Thank you, Mr. San Augustine. Now we'll begin with GMH. If you may want to make comments before we start the questions so that everyone pretty much is aware that they're aware of what they could get and may not get, depending. Ms. Posadas?
Thank you, Senator. And yes, thank you, senators of this 36th Guam Legislature for this amendment with regards to appropriating $5 million from audited surplus revenues from the fund balance of fiscal year 2022 for Guam Memorial Hospital, and also the $10 million from audited surplus revenues from the fund balance of fiscal year 2022. Definitely, it's going to be very helpful. It's going to have a positive impact on the hospital. It does give us then the ability, definitely, to then also recruit more resources, such as physicians that we continuously have shortage, more nurses, more health professionals, such as respiratory therapists, radiology technologists, and other healthcare professionals that we've been needing in that hospital. And then the $10 million, as what is written here, for the purpose of the renovations of the Guam Memorial Hospital Labor and Delivery Ward, GMH Maternal and Child Health Care Renovation Project. Definitely, it will help us. But I also just want to say that, there are other areas in the hospital, throughout the hospital, that need repair and replacement. And so, we also would like to see if there's additional funding for it. And so, thank you so much. That's what I have to say. If you have any questions, I am here to answer your questions. Thank you.
Thank you, Ms. Posadas. Mr. Snobson, I think there may be an amendment that's being proffered that may assist you also.
Thank you, Senator. Some members of the 36th Guam Legislature. For Public Health and Social Services, many of you are very familiar with our services. We have 2 community health centers. And in these 2 community health centers, we provide a myriad of services. Unfortunately, like many other situations that have been long-standing, Public Health and Social Services has been, for many years, managed and challenged with the recruitment of physicians, specialty physicians, as well as midwives, nurses. Just the onboarding process is very lengthy. We do have the facility down south that we would like to open more than what we are today and provide more services. We also need a pharmacist, among other positions. We have a need for an internist, OBGYN, clinical psychologist. We used to have a clinical psychologist on board. That contract is terminated, and we definitely would appreciate perhaps an amendment where funds will be available to Public Health and Social Services so that we can also fund these positions in the coming fiscal year. And we also need a doctor really who is an infectious disease specialist so that they can deal with that area, especially with our area like in TB, HIV, STD. And so like the hospital, we also would appreciate the fiscal support, financial support to Public Health and Social Services to onboard. It's no surprise, and I'm sure many of you as legislators have heard the story time and time again. Onboarding in the Public Health and Social Services system is a very lengthy process. If we hire, and when we hire a doctor, we put them on contract. That's the only way we can offer them more than a classified post. As a matter of fact, history has shown that when we put an announcement out for a classified post, we really don't get a good response from physicians. So we negotiate contracts with them. But that contract, there's a process, and it's not a contract between myself and the physician alone, and it's registered. It actually goes through the process of being reviewed and signed by multiple agencies, and that in itself can take months. While those months have surpassed and have gone, we are then faced with the potential that we could lose that very physician that we're trying to onboard. Another private clinic may offer them a position and pay them even more. So not only would providing us funds be needed, also the ability to negotiate so that we have the ability to be a little more competitive with the market that's out there so that we can retain physicians. If we want to take care of our community before they come to GMHA, I ask for your support so that we can operate both the North and Health Center at full capacity. And that will require staff, including nurses. We say physicians, but in mine, as we know, they also need assistants. We also need administrative staff that would support the whole operation. So for me, it would be looking at that total approach of what teams we would need at both the North and the South. Thank you very much.
Thank you, Mr. Snorkson. Ms. Posada, you wanted to add another
Yes.
comment to?
Thank you, Senator. I just also want to express that, with our perennial struggle and challenge with recruiting physicians, Vice Speaker Senator Tina Barnes has been also helping us. We do have a community collaborative group that has been called together by former Senator Dennis Rodriguez and the governor's office for us to work together collectively to see how we can really enhance and augment and strengthen the recruitment of physicians for the island of Guam. So I just wanted to express that message of appreciation to Vice Speaker Tina. Thank you.
Thank you. We will now begin the round of questions, and we'll begin with Senator Tello Tadigui. Ma'am?
Mr. Chair, and thank you so much for having them come down today because this is quite a bit of money, and we want to make sure that it's going to be used to the best of its ability and something that was needed right away. So my question to you is on the Army Corps of Engineers with the hospital, particularly, did they have a list of what was priority that was needed at the hospital for repairs?
Yes, Senator, thank you for that question. And I'm going to say briefly yes, but I'm going to hand it over to Mr. William Kando, who's really been reading that Army Corps report, even in his sleep, and he'll have all the details of it. But yes, they provided a listing of the priorities.
Okay.
Thank you for that question, Senator Taitagui. Some of the major their major focus was on life safety issues, on issues that involving the physical environment, special focus on systems. Their heavy focus on utility systems that needed to be replaced. Heavy focus on the power, the main panel, the sub-panels, the generator, one of our 1.6 meg generators, well beyond useful life. We even told them that we call it Old Faithful. And so this is really a part of a design project. It's already been designed. The panels, the sub-panels, the 1.6, and the access road in that power plant. So that's already a shovel-ready project. So these are main things: the roof leaking, utility mechanical systems that are also part of the water seepage into the facility. It's not just coming from the roof; it's coming from all over the place, inside the hospital. When heat comes into the building, because we need to be replacing intakes, and so the warm air comes in, mixes with the chill water lines, it's soaking the ceiling tiles. So this is not coming from the roof. So it's just coming from all different directions. Parking is an issue. So we have parking projects that are under the design. They called out the Z-Wing. The Z-Wing is another one that needed to be demolished, and so that we can make useful life of the Z-Wing, expand the parking there. We're trying to expand parking in the center island in front of the hospital, because we all know that parking is a major issue. These are all things that were called out by the Army Corps of Engineers. Fire alarm system, sprinkler system, this was really their focus.
Can you tell me about, you attempted to get a grant to cover the cost on the panel, the electrical panel, the sub-panel, and the generator. How much is that going to cost? Because that's like on the top. I know you're doing the roof right now. You already have that going on. That's great. How much is it going to cost to address the next thing in line, which is the electrical part and the, how much is that going to cost? And did you go out for a grant on this, and what was the status, and then where are we today?
We did go out we tried to participate in an OLDCC, the Department of Defense Community Cooperation grant, their infrastructure pilot program. We had it valued at $15 million, which included indirect cost rate of 20%. We have a recent cost estimate for the project. That cost estimate without the indirect is about $12.5 million. So our focus is on trying to secure $12.5 million so that we can, one way or the other, do that major project, which is really shovel-ready. But the grant was rejected because it was a very competitive grant, so we just didn't have the opportunity this time around to be successful with that grant program. But they are encouraging us to communicate with them in the month of October to see, give us more information why we didn't win out this time, and appropriations were limited as well. So we're still in the game, and of course we're looking for other opportunities, funding sources to do the project, if not in its whole, in phases.
And it's $15 million, you're saying?
I'm sorry?
It's $15 million to address just those three. And I know
Yes.
you mentioned further down there were other issues. Based on the Army Corps and Engineers, they put this based on really what is the priority for the hospital, right? And after the roof, these are the next things that are needed. Is there any mention of a maternity ward or anything in that Army Corps of Engineers as an issue?
It's mentioned in the assessment because during their assessment, we provided them our designs of the Family Birth Center. So we just wanted to let them know that this was another, potential project sometime in the future that, we have our eyes on, but it wasn't identified by them as any major life safety issue, although they understood and documented why we need to upgrade the utility, the HVAC system in hospital-wide, which included all MCH units. So parts of that assessment do include the maternal and child health units, but not particularly focused on us doing the Family Birth Center. Although, of course, we feel that renovations, hospital-wide renovations, we take into consideration all of them throughout the hospital. But in the lens of what are our greatest priorities.
Yeah. So Lillian, if you were given $15 million today to address some of the issues at the hospital, it's a beginning. I know you need more. I think it's at $700 million, but of course. Which would you use that funding for?
It's my responsibility of the whole hospital, it will be the electrical panel, because that's going to benefit the whole hospital, not just one section. So of course, it will be the electrical panel. And I know several years ago, when we appeared before this legislature, when we were, defending our budget, we mentioned the electrical panel was a priority, and it still is a priority.
So that's what's needed right now. Does have to do also with your accreditation coming up?
We are going through the accreditation. We've already allocated budget for that, funding for that, and so we are going through the process of accreditation. Yes, ma'am.
Does this also affect your rating for accreditation when it comes to not having these electrical panels and subpanels and generator in place?
They will look at that. Yes, that's part of the accreditation, which is on the side of the environment, the facility, and life safety. They certainly will look at that.
Does the administration as well, Guam Memorial Hospital, still have the ability to seek out funding for the maternity ward? That was a public law that was passed that allowed $9 million, I think, at the time. Do you still have that capability to do the authorization to go seek funding for that?
We can then work again with GIDA, because that's how it was. It was a collaborative loan process with the GIDA through USDA. That was what it was, $9.5 million.
Can you tell me why it stalled? Why did it stall?
Well, at first, when USDA approved it, there was a condition that they put on that loan application. And the condition was that we were supposed to, between GIDA and GMH, was supposed to get a interim financing. And so GIDA issued out an RFP for a financial institution to then, do the interim financial coverage for that loan. That was the condition. And so GIDA they issued an RFP. One financial institution responded. USDA came back and said that they needed to issue another RFP to get at least another financial institution to bid, to propose.
And is the hospital pursuing this?
It was GIDA that was taking the lead. It was a collaboration between GIDA and GMH.
And are you guys still trying to pursue this?
Not at the moment.
My next question is the $5 million that is on the First Amendment that you have. Did you ask for this funding, this $5 million?
No, ma'am, but if you're offering it, we'll take it.
Okay, well then if you didn't ask for it, then does that mean that you don't have a plan for this $5 million?
We could always use the $5 million, and as far as what's stated in this amendment was specifically then to recruit specialty care physicians. That was the purpose of this $5 million, and certainly we will use it to recruit physicians, to enhance and to augment our recruitment strategies, to bring on more physicians.
Okay, then how are you going to sustain this?
How are we going to sustain it?
Right,
Again,
I mean, the $5 million is coming now, but how are you going to sustain it afterwards?
Okay, well, we may not be able to use the whole $5 million up front, and so therefore we will keep it and continue it. And then once we get more physicians into the hospital, this will help us generate revenues for the services that they provide. And that can then be a way to sustain keeping these physicians on board.
Okay. This is for specialty care, and don't you think you're going to need technicians, nurses, equipment for these type of specialty care areas? And that means the hospital would have to come up with additional funding for these, the equipment needed. Is that true?
Well, yes, we do need equipment, absolutely. We do have equipment that are already outdated, have exceeded its lifespan. But according to this amendment, it is not limited to. So definitely we can then, it will allow us, not just the physicians, but other healthcare professionals. As I mentioned earlier, respiratory therapists, radiology technologists, echocardiogram specialists. And so, yes, we certainly could use this funding.
Okay, and then how long will it take before you can actually implement something like this?
Implement something like this? We already have a process in place to then recruit physicians. So it's already in place. Implementing it is not a problem, it's getting the funding.
Oh, and it's also this, I think what you mentioned, well, the question I asked about sustainable, how are you going to sustain this? And then your comment again was to save some of it, or?
Well, we may not be able to use the $5 million, all of it at one time, and so The more we recruit physicians, the more that we can then expand the services, such as outpatient clinic services, more surgical procedures, that we can then generate revenues for the hospital.
But Lillian, shouldn't you have a plan in place, before something like this? I mean, just throwing $5 million at you right now, it might be even more. You might come up with a great plan that actually can, assist. I mean, if anybody knows, I've been off island for care. I've had to leave off island for care myself, and having specialized physicians here is very helpful, but we also know the reality of specialized physicians or care. It's very difficult to sustain any kind of doctor coming here with one particular specialized care to be able to sustain themselves. So wouldn't it be more prudent then to, well, I know you need it, yeah, but put a plan together and how you're going to sustain this, how much is it going to cost the general fund every month as you move forward, and then the equipment, the technicians, to also support that particular physician is going to be needed. So a plan should be implemented,
Sure.
on that, so.
We can put together a plan. In fact, we already have a plan, recruitment and retention plan for nursing, to recruit nursing. I'm in communication with the new Naval Hospital Commanding Officer, Captain Barrows. We've met with them, and there are some OBGYN doctors, neonatologists, some other physicians who are willing to work outside of their military structure. They can then be hired as part-time physicians at the hospital, and so they can come work with us. So that's all part of the plan that we can then put together in writing and make it, organize it and structure it that way.
I'm looking forward to that plan, Lily, and anything that we can do to help. But right now, I think it's important to have a plan in place first before anything. And before I turn it over to my next colleague, I just wanted to, once again, how much is the cost for the electrical panel, subpanel, and generator that you're trying to get up and running now today? That's critical. How much is that total?
As Mr. Kando mentioned, it was tagged, the price tag in that grant that we applied, $15 million, but that included the 20% administrative costs and other stuff. But, really, 12.5 is what we can use for then the electrical panel. If I may go back to the recruitment of the physicians,
Sure.
we also have a plan working with the New York Institute of Technology. We're creating an affiliation, an agreement, and pipeline to then have some of our young people who have completed their degree in biology to go on to medical school, and that they can then enter that medical school. And already we have one individual from Guam, another one in the pipeline, and they will do their clinical rotation at GMH on their third and fourth year. So that plan is in place in terms of recruiting physicians.
Sounds good. Thanks so much, Lillian, and I appreciate the hard work you're doing at Guam Memorial and also Public Health. Looking forward to you responding to my letter, Mr. Director, please, right away, because I have a constituent who needs help. But Lillian, again, I do understand that that could be part of the plan, but also please incorporate telemedicine.
Thank you, Senator. We have telemedicine in place for intensive care, and then we've also expanded it to neonatology, telemedicine. So yes, it is growing.
That's very good to hear, especially in specialized areas.
Correct.
Where, we can still have our people here, our constituents here on the island, and having to need that specialized monitoring, that telemedicine has come a long way. COVID has shed some great things on us. So again, appreciate your time. Thank you, Mr. Chair.
Thank you.
And thank you, Senator Tello. Senator Blas, do you have any questions for the panel?
Yes, sir. Thank you, Mr. Chair. And to the panel, thank you. Welcome for being here. Ms. Posadas, what would you say would be your greatest challenge in as far as recruiting specialty physicians for the hospital?
Okay, thank you for that question. The greatest challenge is salary, compensation. It's really been very difficult to try and get doctors here on island, being distant and far away from their families, from the mainland. So the salary is where we're challenged to negotiate an acceptable salary.
Okay, and in your experience and as far as trying to negotiate, what's this figure, what's this number that sometimes we have a hard time in our recruitment of trying to match or meet for their salaries. What are we talking about as far as per physician?
In the specialty areas such as OBGYN, the running rate is $200 per hour, is what these OBGYNs, request for. And keep in mind, that's one of the specialties that, malpractice is high. And so, of course, and it's a specialty, and so they would like to be compensated in the realm of $200 per hour. Emergency room physicians, about 210 is what also their asking price is. Neurosurgeons, that again is a very, very highly skilled area, a practice. So I don't know the price of it per hour, but it's a very expensive specialty. So those are the ranges of some of the specialties for hourly salaries.
Okay. So is this assumption of the $200 an hour, is the negotiation part of that, is that GMH is responsible for $200 an hour for 8 hours, 5 to 6 days a week? Is that what you're looking at?
If that's how we're going to bring those OBGYN doctors and
Okay.
specialties, then this is something that we would need to consider offering.
Okay.
Yes.
Now, based on the services that you do provide now, and then I'll get into the services that you want to provide, okay? But we're just talking about the services that you do provide now in the hospital. Are you lacking any specialty physician services to fill the roles in these areas of what you expected to provide now?
Okay. In the area of radiologists, we're very fortunate that we do have individuals in the community who are helping us out. And we also have those we call night hawks. These are radiologists who in the night shift are in the mainland, are able to read the images that we send to them. And so they augment our radiological area. There is also interventional radiology, wherein these are the radiologists who do procedures such as insertion of catheters under imaging diagnostic process, or do other procedures under the radiology guided imaging without having to take that person into the operating room. That will be helpful so that you can minimize the invasive procedures. And so it's an outpatient, procedures that can be done by the interventional radiologist. Other areas, perhaps probably internal medicine, who we hire then as hospitalists who are then available in the house, 24/7. Those are other classification of physicians that we hire, internal medicine doctors.
Okay. Now, do you have basically house call surgeons?
Yes, we do. They rotate through.
How
We
much
have
do
a
you
group
pay
of
them a day?
surgeons. How much are we paying
What's
them?
the negotiated rate of paying them a day?
You know what, sorry, Senator, I don't have that information right off the top of my head in terms of hourly, but I can certainly get that for you. We do have surgeons that are on on-call basis, so that when a person comes into the emergency room with an appendicitis and needs a surgical procedure to be done, the surgeon on call is called by the ER doctor to come in.
Okay, well, and the reason why I'm bringing this up is because in discussions with individuals in the medical community, one of the concerns that was brought up is in certain specialty areas or certain areas within the hospital where you have the physicians and stuff, they are actually being paid higher than the national average and higher than most other surgeons or physicians in that same area, in top-rated certified hospitals are being paid. And I'm a bit concerned there about whether or not, this is a continued practice or if this is actually, that's what I'm asking. And as far as as far as the physicians that you have there, okay, are we paying them above average, national average in some cases for their services? I also know that there was some concern that was brought to me that you got some that are supposed to be in-house working 24 hours in the hospital, but while they're working, they're basically duty physicians. They're allowed to take appointments. and charge them at the same time when the government's paying them.
All right.
And so, those are some of the concerns that I have. And so when we're looking at something like this, I just want to, first off, maximize the bucks that we have, but ensuring that in this thing that we're not, for the lack of a better term, getting scammed.
Okay.
Okay, I mean, if I offended anybody in this process, but this is coming from the medical community. Okay, and that's the concern that I have here. The last question I have is actually if in these specialty services that you want to provide, obviously this is just for the recruitment and for the retention of these specialty services. And it goes back to a question that my colleague previously asked. Is the space and the equipment sufficient or adequate enough so that when you bring in these specialties, that it's not for lack of space or equipment that they will not be able to perform it, and so then we're paying, $200 an hour, $2,000 a day for somebody to sit there and he can't do anything because he doesn't have any equipment for it. Okay. So I guess there's something to ponder on, something to question with, and something I will continue to listen to the rest of my colleagues in as far as the questions are concerned. But these are the questions that were brought to me by, again, people in the medical community, that I hope is something that we can look to being able to maximize and to make our more efficient use of our dollars. Okay?
Thank you, Senator.
Thanks,
But
Malik.
If I may comment on the physician salaries.
Sure.
There are two different classes of physicians that work at the hospital. One of them are GG1, employed physicians, and so they are pretty much considered classified. And so some of their salaries may be different compared to those who we contract. And so that's where the difference is in terms of the salaries. But thank you for bringing those concerns to my attention, and if you could give me a little bit more details, and I can look into it so that then we can make sure that we get the facts that are truthful and not that it's just, again, assumptions or, only one side. But please,
and that's what I appreciated. There's always two sides to a coin, and so
Yes.
I bring this up so that we can have further discussion on it, okay?
Thank you.
Thank you.
Thank you, Senator Blas. Senator Pidu Terlai, do you have any questions for the panel, sir?
First off, Mr. Chair, I want to thank the panel for showing up. Some of the questions that I wanted to ask is kind of overlapping with what the senator next to me brought up. I just want to go back on the electrical system that you have. Is that for repair or replace?
This main panel and sub-panels, this is in excess of 45 years. So, I mean, it's way
So we're talking about to replace.
total replacement.
Okay.
And also relocation away from, it's in the heart of the power plant, next to other main utility systems. It's near a water tank, holding tank. So we're trying to get it outside its own structure so that we remove the risk. Not only do we pursue a new system, but make sure that we're not jeopardizing the main panel and the other systems around it, so that we have the whole power plant, maintain the integrity of the whole power plant.
But the estimate to replace the electrical system is going to cost $50 million. Would that be an accurate figure?
The main panel and the sub-panels are inside the hospital on the different floors. We're also replacing a 1.6 megawatt generator. So in its entirety, the recent cost estimate from the designer is $12.5 million.
Okay. Leo, have you look over the amendment document?
Yes, Senator Pidu. Which one? The amendment that gives us 5 million or 10 million? The 10 million?
No, I'm talking about the medical professionals that is listed on this particular document.
Okay. The 5 million that will then be appropriated for the purpose of recruitment and hiring of specialty care physicians? Is that the one that you're talking about,
Yes.
Senator?
Is there any other medical professional positions that you might want to hire,
Yes.
missing, the services at the hospital?
Absolutely, Senator. Endocrinologists, we need that. We need gastrointestinal specialty. We need that, that kind of a physician category. I know that there was others, but I'm so sorry. My mind is drawing blank right now.
Because I know there's so many,
Specialties.
medical professions that is available out there, and some of the things that is listed down here, some of the, medical professionals that they have at the hospital, there's several that's missing that I am aware of.
Right.
So, Leo, this is what I want to ask. If you can give us a listing of those medical professionals that you need at the hospital.
Yes.
So when we do this amendment, we can complete the total medical professional listed, so that maybe we can consider, additional money for that.
Okay.
So, and that goes to the Director of Public Health also. If you can give us a listing of that, so that we want this document to be complete in as far as, the needs of the hospital and public health.
We'll do so, Senator. Thank you.
Mr. Chair, thank you very much. That's all that I have.
Thank you, Senator Chulai. Senator Perez, do you have any questions for the panel, ma'am?
Thank you, Mr. Chair, and good afternoon to GMH and Department of Public Health. Yeah, a lot of my colleagues asked a lot of the good questions. Maybe more of a big picture question as far as financial planning for GMH, because I know we're looking forward to rebuilding the hospital, and we know we don't know what the timeline is for that, and so maybe I just want to hear from you in regards to how much do we need to spend at this moment just to keep the hospital going in the interim, and then also is there like a financial revenue plan, because for instance like Grmc has specialties there, and probably it's best not to be redundant, or I don't know if that's the case, if that's one of the considerations is redundancy, or have a cooperative agreement with them that there's going to be different disciplines, different specialties that GMH is going to specialize in. So maybe if you can talk about those, what is the plan financially for GMH at this time, as far as expenditures, what you need to expend money on critically, or what are the critical needs for now? How much do you think, what is a threshold? Just, I guess it's more of a overall, overarching question.
So thank you for that question, Senator Perez. We have, of course, our annual budget process that we vet with all the departments every year. And that all begins with our financial projections of what we expect to collect from our billings. So that does greatly reduce the amount of cash that's left over for these types of projects that Mr. Kando has been talking about. So I've always been a big advocate of, when these projects are brought to my attention that we need funding for, please, can we try to find a grant? That's always been my first thing, is I'm like, can we find a grant? And so we have been trying to pursue grant funding for everything across the sun, but as you can tell, in some cases, we're not approved for the grant. And when these projects come to my attention, I have to go outside of what we've planned for the year as far as the budget is concerned. And of course, if something dire comes up, we have to fund that. It just has to be done. And that means we are going to take away resources that we had planned to spend for other things, because we have to now reallocate it to these emergencies that come up, and they do. Once in a while, some things come up, and we just have to repair it, we have to replace it, we have to fix it. It just has to be done.
And so the priority would be obviously it's the electrical panel. And you don't have funding right now.
No, not $12.5 million, no.
For that. Okay.
Absolutely not. No.
Okay. And then I guess the other part of the question was cooperative agreements with GRMC and other clinics. Is there like a division of which specialty the hospitals are going to indulge in? Or is it pretty much you're independent?
We're pretty much sharing resources, but yes, GRMC, from what I understand, they do have some specialties, such as their orthopedic surgeon that they have there. We do have orthopedic surgeons also within our community who then have privileges into the hospital, and so they rotate through being on call. If in the event, you come into the emergency room with a broken hip, the orthopedic surgeon on call for that week is called upon. So, and other specialties that GRMC has, I really don't know, but some of their cardiac cases, they refer them over to GMH because we do have a cardiologist that rotates and does the pacemakers, does stents. And so we just share resources, whenever the need arises.
Yeah, thank you for that. And because, I know that, heart, these chronic health issues are still with us. We have cancer, high rates of cancer. So, maybe, we can leverage the resources of all, health institutions here so that we're not duplicating efforts. Or if we need to, maybe there might be a need for redundancy. But I think since we have such limited resources, it'd be good to kind of spread it around. Okay.
Thank you, Senator. If I may add, in October, we are going to have a tri-hospital meeting, and that's GRMC, GMH, and Naval Hospital. And we're going to sit at the table to discuss these issues and what resources we can then share and perhaps even craft a memorandum of agreement between the three hospitals.
Okay, that's great. Great to hear. I think those are my questions for now. Thank you.
Thank you, Senator Paris. Senator Amanda Shelton, do you have any questions for the panel? None. Madam Vice Speaker, do you have any questions for the panel?
Yes, I do, Cito Osmasi, Mr. Chair, and want to thank the panel members for being here on such short notice. And before I start that questioning, I just wanted to be clear, Mr. Chair, that I, of all people, want to improve our health care here on Guam, and my concern is that I know that we don't have, an endless credit card, and we do need to figure out what is the most immediate need. So all of you here up there are the healthcare experts, so maybe I'll start with you, Art. Can you tell us in the simplest form what obstacles when it comes to hiring doctors at public, what are the obstacles when it comes to hiring doctors at public health? And in the simplest form, what are the specific support you need to hire the doctors?
Thank you very much for that, Vice Speaker Barnes. To your question, Senator, Vice Speaker, the biggest obstacle really is the recruitment process in and of itself. The contract itself requires 8 signatures, and some of that is internal, myself included, the physician, funds to be certified, but then it does get circulated to other agencies for their signature. And I'm just going to pull up a sample page here so I can share that with you all this afternoon. So on a signature page, in addition to the physician's signature, my signature, and our certifying officer, our chief public health officer, it also requires us, the approval on this form for the DOA, and that's why they registered, but prior to that, it also goes through BVMR, and then also to the AG's office, and then, of course, once approved, it's approved by the governor of Guam, and then it's registered with DOA. That's when we will be able to get that contract in effect so that we can hire a physician. In terms of our biggest challenge really is compensation, similar to GMHA, but ours is compounded because of the length of time it takes to onboard a physician. So that really is the biggest challenge we have. The provisions don't really give too much flexibility for us to be competitive, and the length of time is sometimes the cost for a physician to be offered another post within the private sector. And although they They initially really were very passionate about working for public health and had a great interest in doing so. We sometimes lose that applicant because of the length of time it takes us. And that also is a process that onboarding, just for classified employees, we have that, and then we have a contract version. They both take months at a time sometimes, at times, to onboard a person or a physician, a nurse, and administrative staff, and to support the physician and the nurse.
Wow, okay. I guess then to both GMH and public health, I do not mean to pit one against the other, but like I said earlier, I'm not the healthcare expert, but after talking to a room full of physicians, you know, especially the physicians that do not work in the government of Guam, but rather in our community, you know, the private sector, there seems to be a convincing argument that putting doctors in the community and making healthcare more accessible, especially for the most vulnerable population, I think it would make more sense to provide care at the community level before our people have chronic issues and then end up needing the specialists at like GMH. So quite frankly, it seems like we diagnose and treat early on. That makes more sense and has a better prognosis before it becomes fatal, right? So maybe from both your perspective, can you give us your perspective on this statement?
Sure.
Or this sentiment?
Sure, absolutely. Let me go ahead and start. I'm sure Lillian can add on to this. And really what we're looking at is the continuum of care. Community health centers are here in our community, and they provide preventive care. And so we could provide a lot of the screening, as you said, Vice Speaker, that if we identify a medical condition, an element, and then we can provide intervention, perhaps at that point it's early on enough so that they don't require more extensive care at GMH. We know that just as a practice, for those folks who are uninsured or underinsured, a lot of times what they do is they show up at emergency room. And really, if we can build our community health centers to be robust, to be a focal point for preventive care, for prenatal care and other services, primary care that we provide at the health center, in the form of even of education, intervention, outreach. I know it sounds like outreach, well, that's all part of the continuum of care. Get out into the community, provide clinical services in the community level. It really can, I believe, have a positive impact on the hospital, on the demand placed on the hospital. And when you talk about access and reaching, yes, definitely, I'm a member of the PEHOBA group. It's the Pacific Island Health Officers Association. Lillian is also a member. Just today we talked about COFA, and really one of the areas that we're really trying to take a real deep dive in is working with that community and bringing them in for services, making it more affordable, accessible. The Governor's Relief Center project that we've launched, I think in July, that has really helped. We've had over 100 referrals for public health in the area of public assistance, and so there is growing interest in this facility being accessible, and we are supporting that, public health and social services there. We have staff there as well. So if we can build a robust community health centers both north and south and invest in that, then we're also investing in the community's health. And in investing in community's health, we hope that that would result in greater outcomes and better lifestyles, because that's where we cover the whole gamut. And then when they do need to go to the hospital, it's because they're at that point where they need actually medical care in an institution like setting like Guam Memorial Hospital. You know, I can turn that over now to Lillian, I believe.
Thank you, Art, and thank you, Senator, for that question. Absolutely. This is really what we like to do, to see, is to really expand and enhance more of the preventive care out in the community so that they don't come into the hospital already really severely and critically ill. One example is diabetes. If we can help, diabetes on island is very prevalent. And if they don't get support to manage that and to really, keep that diabetes under control, they end up being hemodialysis patients. We have hemodialysis patients growing crazy, like wild here on this island. It's just, the number have just continued to increase. And when their conditions are poorly managed, poorly, controlled, they end up being severely sick in the hospital, needing the dialysis treatment, may even end up in the ICU level of care. So if we can really work together to make sure that in the community, that primary prevention, primary care is provided in the community, we can definitely minimize the hospitalization, the need for acute care in the hospital.
If I may, Senator,
Yes.
we're really part of the continuum of care. We're all part of it. We're not actually, I hate for anyone to think that GMHA and Public Health and Social Services are competing in terms of care. We're actually a part of that continuum of care. We do our part, and if we are as effective as we hope to be and achieve our desired outcomes in a healthier community, then we would reduce the number of individuals that are accessing GMHA for care that we can hopefully provide. So we're like intervention, education, prevention, outreach, changing lifestyles. We cover a myriad of different services, and I see myself as a partner to the GMHA part, and we're not so much competing. I just wanted to say that. Thank you.
Thank you, Madam Chair now. I just want to say that having been given the opportunity to share some of the policy that we have done, to share with the physicians and the working group, the continuum of care that you two work together, I just want to say that I know there's more than just looking for specialty care out there. I know that we can look at, procurement is an issue, amending some of the PRRs, we look at tax incentives. I mean, there's a plethora of things that you as the medical health experts have been looking at and, realizing that everybody's coming together to try and help. Madam Chair, if I may, and as I said earlier that I supported the proposed amendment, I literally have another amendment that I'd like to add to that to make sure that it's inclusive of the Department of Public Health also, and then maybe the changing of the amount. But that amendment is coming down, and I know we do the round of talks in this effort as we are in the Committee of the Whole. So just note for the record, and I have a minute left and my time is almost up, but that there will be a proposed amendment coming down, because in that effort, I want to make sure that both GMH and Public Health continue, because we are one team. We are the same government. We are one government health community that needs to work together, and I'm really glad that you shared that openly, because you both need to work together, right? We have to provide for the basic services, especially as it relates to the healthcare to our community, and those who can't go to, they work with Public Health in the village communities, and then, then it comes to GMH. So please know that, Madam Chair, I want to work on providing that and making an amendment to the amendment that is being proffered right now. So that amendment's coming down. Thank you. Thank you. I have 41 seconds
Thank you,
left.
Sidus Masi, Vice Speaker. Senator Brown.
Thank you, Madam Chair. I find it odd. We're within hours of the people of Guam deciding on an election for the primary, and we're here almost having an informational oversight hearing on the Guam Memorial Hospital, because we're trying to decide how we're going to address the funding that some of our colleagues here are proposing, really without the basis of information that's needed. There's a whole bunch of reasons why we don't have certain specialties on Guam. Certainly, appropriation and the funding is one of them, but there's a whole host of reasons, and it's not isolated simply to the fact that we're going to put money and continue to put money that shortly we're not going to have available. And so that's a very good question I want to ask the administrator of the hospital, because this is a one-time appropriation. Should this be included in the budget? How are you going to sustain it, especially if we look in the next year or two, maybe 3, maybe not even that long, that the funding's not going to continuously be. I want a lot of things. I want the nicest car in the lot. I want the leather seats. I want the car that literally drives itself. But can we afford it, and can the people of Guam afford it? We want a lot of things. I think we all want the best of healthcare, especially if we're in that situation of need at that moment. We might not have the luxury of being able to travel off island. But there's no endless amount of money, and I'll tell you, this budget's just full with appropriations galore that in the near term, we're not going to be able to follow through with. So I don't want to sit here and go, oh, sure, here. Let's all hold hands and kumbaya, when I don't have any confidence that we're going to be able to consistently fund these programs, or even in this case, these, list of specialty care that we'd all love to have. So what would you look at as a plan to sustain if the appropriation's not going to be there? You bring these people out, and a year or two from now, you can't pay them. What's the plan?
May I answer now? Thank you. Again, we did not ask for this additional funding. This was offered to us, and so, we're here to say that we can use this additional funding. And definitely, as I answered Senator Tello-Taitigwe's question, what is the plan? We can use this funding to then recruit additional physicians, additional healthcare professionals that we really need, so that we can enhance and expand our services. And then when we do that, it gives us the opportunity to generate some revenues to then sustain it, so that our operation revenues can increase. That's the plan as far as if we do get this $5 million. We didn't ask for this.
No, and granted,
And so,
I didn't say you did. But the fact is, if you accept it, and if it gets included in this budget, again, I don't want to put ourselves in a situation that we're going to put this up short term and then long term it's not there.
Mm-hmm.
There are reasons certain specialties are not going to be available in a small island community. I think we know the practicalities of that.
Right.
You can't have some of these special positions that, a doctor maybe once a week, once a month, once a year is going to have. It's just not going to be sustainable.
Mm-hmm.
But I also want to make sure that all the money that we're spending is going to go to long-term investment and not just a short-term, because like I said, we are on the eve of an election tomorrow. And the fact that we're having to do this now, that's not vetted, that has not gone for public hearing, that's not, even GMH is sitting here telling us, well, they didn't ask for it. And granted, in all fairness, you're right. You didn't ask for it.
Mm-hmm.
But some of us are put in this awkward position because these things are being proposed. I do want to ask, because the last time GMH was here, Mr. Canto, you went over what the upgrades and improvements are at the hospital. And now it's been brought up that perhaps, you've relayed that the key priority is your electrical system. And we know that the issue's been long-standing. And I know that, you're working with GPA to keep that running. But there's also other proposals. And I don't know if we're going to go back and call you back for the other amendments that are here. So I'm going to ask now. We're hearing, negative discussion out there in the world of social media as well, that the labor and delivery room does not have the most basic sanitation and operation and functioning. And is that the case? That now we're throwing money, another $10, $15 million towards it, again, on the eve of an election, without properly vetting these issues or going out and having public hearings and also input as to, is this indeed the case, and is this the best use of limited resources that are available?
Thank you, Senator Brown, for that question. It's an ongoing battle every time it rains. We are replacing our HVAC systems throughout the hospital. That includes L&D, OB ward, nursery. We're repairing the roof and the envelope. We're actually in a position to issue 3 NTPs to 3 different contractors for the rooftop first week of September. And we've been replacing mechanical systems on the roof as well, because that's the point of entry for a lot of the water as well. So as the water comes in, yes, the water gets on the floor, ceiling tiles get wet from the chill water lines. So we bring them down. Sometimes they fall down. If they fall down, we try to get them off the floors as quickly as possible. We try to get the water off the floor so the the floor tiles don't pop. It's an ongoing battle. Our housekeepers, I can't say enough about our environmental service staff. They're just, they've gone through COVID, and now they're going through a typhoon season, and it's a constant battle of cleanliness. Even, as we're trying to replace the air handling units, until that happens, there's moisture in the facility. As we clean the floors, there's mold growth the next day. So we're cleaning the floors every day. And so we're even looking at, because sometimes our environmental service staff department is short, and right now they're short about 7 or 8 staff. So Lillian and I discussed it with our chief of environmental services. We're looking at outsourcing some of the common areas, the main corridors, the lobbies, to help them so that they can continue to fight the battle but bring in some reinforcements temporarily. So we're looking at all those avenues to do it. And so, we just ask all of the staff to be patient with us as we make these repairs, these upgrades. It takes a little time.
I appreciate your consistency because you did relay to us that you are working on the roof. And you have funding for that, I assume, because otherwise you couldn't procure the contractors. So again, between the choice of addressing the, your power system versus labor and delivery, are there any other deficiencies of anything that's inoperable within the labor and delivery rooms? Because this is what we're hearing, and this is, we can't write fast enough and get our names on amendments so we can take credit for it. Is that indeed the case? Is what's being reported truthful? Or just somebody's complaining because they love to complain? What's the real situation?
The other part of that story with the Family Birth Center that we never got to construct, we did proceed with the FF&E package for the L&D OB ward and nursery. So we bought for them close to $2 million worth of the medical equipment, the new beds, the new monitors, bassinets. So we're continuously buying them what they need medical equipment-wise. So, of course, now we're very close to putting in a new air handling unit for the L&D, and then we're in the design phase for the OB ward because we're going to be moving that air handling unit on the roof, and we'll be launching that soon. So, really, before we do any major renovations, we need to fix the ventilation system first. So that's really our approach.
Well, I appreciate it. I've only got a few seconds, but I just think if things went in proper order and we have this type of engagement to know what GMH's priorities are and have that listed and then fund it accordingly where we have some sense of concurrence, I think that would be far more beneficial to our people than these last-minute amendments being added to the budget bill without identified plans. And then we're going to have to come back after the fact to determine whether or not they're successful. Or we have the ability through the funding to be consistent and continue to provide these specialty services, which with the amendments before us, I have reservations. Maybe we can do it right now today, but can we sustain it? And I don't know where the funding source is going to come to sustain it. So I appreciate you responding to my questions. Thank you.
Thank you, Senator Brown. Senator Atta.
Thank you, Madam Chair. Thank you, everyone, for being here this afternoon. I continuously hear about the electrical plan, and I know that's been an issue for many years. I guess, Lillian, on a scale of 1 to 5, how critical is the electrical panel to be replaced?
It's critical.
On a scale of 1 to 5, what would you rate it at?
5.
5?
Right, because
Okay.
if it goes out, if that electrical panel goes out, then that's it. We're doomed.
So I know Guam Memorial had $17 million in ARP funding. Was any of that set aside for the electrical panel or for?
No,
So what was the $17 million used for?
all kinds of PPE.
The ARP money really helped us sustain increased costs during the pandemic. Even right now, we're experiencing increases in pharmaceutical supplies, equipment, power, water, everything is just going up. We also have to pay our employees more. We've instituted differential pays, especially for the nurses, in order to recruit and retain so we can provide the services. We also have travel nurses also still on staff. Although we're reducing the amount of them, they are still relatively expensive. So we have used the ARP money to sustain our operations.
So how much of the ARP funding do you have remaining that was allocated to GMH?
We used all of it, as far as cash flow is concerned, yes.
I see. So
Senator, if I may add,
Sure.
Also with the ARPA funds, we used it to procure cardiac monitoring equipment so that we can then make sure that pretty much every bed has a cardiac telemetry capability. We also use it to then upgrade some of our rooms for negative air pressure in response to COVID. So that's where a lot of the funding went to.
Okay.
The portable X-ray machines.
Did you guys request additional ARP funding from the governor for the electrical panel, being that it's critical? It's as you said, a 5 on a scale of 1 to 5 to be replaced. Did you guys request any additional ARP funding from the governor for that? Do you plan to request the governor for additional ARP funding? I mean, we got over $160 million sitting in an account for a new facility that it probably won't be built for another 8 years. And if the electrical panel is such an issue at this point in time, wouldn't it make perfect sense to request for that $12 million to replace the electrical panel, get the generator and everything else, so that, like you said, ma'am, if that panel goes out, our hospital is completely down, right? So
That's why we went through the grant opportunity, but unfortunately, we were rejected for that one. So we're going to need to find another source of funding, yes.
Yeah, because, I mean, we have money sitting. We have money that is currently sitting, just not doing anything, and we could use that to replace the panels. I mean, we don't know how long we have. Mr. Candle, you said, it's been there for 45 years now? So, I mean, we need to look at the priorities, and I know there's many priorities at the hospital, but if the electrical system goes down, monitors are not going to make a difference. Electrical beds are not going to make a difference. Air conditioning and HVAC units are not going to make a difference. So I think putting the priority on the electrical panels and requesting an immediate, I mean, we're still in a public health emergency declaration that is still here. Let's get that money to the hospital from the money that is still currently waiting, so that we can replace those panels, and the people of Guam can, have at least a sigh of relief that we don't have to worry about electrical panels. It'll be something else we need to worry about. And I'll just leave it at that with the electrical panels. The only other question I had is, we were talking about the amendment that was made here for additional physicians and things like that. Do you guys have a physician compensation report available?
What was that, Senator? I'm sorry, I didn't understand.
The physician's compensation report? Do you have it available for your hospitalists and your contract physicians?
No, right off the bat, I don't have it with me,
Yeah.
but our medical staff office can provide us that.
Yeah, it would be great if they can provide it to us,
Sure.
so that hopefully within the next day, Madam Chair, if we can have that available, perhaps maybe by Monday, it'll give them the weekend to. Thank you, Madam Chair. Other than that, I know my time's winding now, so I'll just leave it at those two. And again, I really implore you to, go ahead and just ask the governor for, additional funding from ARP that's not currently doing it. I mean, when you look at the different categories that where ARP was appropriated or allocated, a lot of the agencies haven't touched the ARP, or the very minimal expenses. Give you a good one here. Revenue tax, IT, contractual needs. They were allocated $7.1 million, and they only used $145,000 out of that. So, I'm pretty sure she has the ability to reallocate from one agency to the next, and with the electrical panels being at a 5 critical, I ask that you guys please go back and ask her to, let's take care of this so that we don't have to worry about it. Thank you, Madam Chair.
Thank you, Senator Ada. Senator Moylan?
Thank you, Madam Chair. Thank you, panel. Lillian, I think it was the 35th Guam Legislature, we were talking about this Army checklist, right? And that Army Corps of Engineers report came out on, recall what year that Army Corps of Engineers report came out? Do you recall the year of the report? Thank you.
Yeah, they came through in November of 2019, but the report was available to us in March of 2020.
Thank you. I think we did talk about this back in the 35th Guam Legislature, and we tried to make some changes to that, but somehow the priority of the panel became not that a priority as it was initially, and somebody killed it. I'm not sure why, but then GPA came in and helped things out. But still, obviously, it's a problem. For the past speaker here, I think it's important that we also make that loud and clear to the administration that if this is such a dying need like it was previously, then let's use ARPA funds. I'm hoping that the argument can be made for ARPA funds to be used for this purpose, especially the panel. The money is there available now. The funding that we're talking about for the L&D ward is upon audited surplus amounts. That's months from now, months and months from now. And we don't know the exact number. But we have ARPA funds available that has been used for the purpose of COVID, right? And this can say, of course, we can make the argument similar that the strain on the facility itself has put more strain on the electrical panel, possibly. We can write it in any way to make it convincing enough for our administration to give the argument that this money can be used for the purpose of correcting the electrical panel. Okay, so even if we were to use this money and we can get you $10 million, if it's amended somehow, it doesn't matter. But if we give you additional money, it's not going to be for another, the next administration, and whatever their priorities are, right? So I really stress that ARPA funds should be used for the electrical panel. But going back to this also, did we have an A&E done already for the labor and delivery ward?
Yes, we do. It's expired. It was done in, the last time it was certified was 2020. I believe it was May or June of 2020.
We had what was the cost of that?
It was, cost estimate placed it at about $9.5 million at that time.
The cost for the A&E?
The A&E what cost about $855, shy of $900,000.
So we had that done, we used this money, and it died, right? It has to get recertified or redone or relooked at, right? In other words. And when we had that A&E done for close to $1 million, did you come before the legislature to discuss the problems with the L&D at that time? But there was a public law made for this. You're familiar with the public law. Did you testify at the public law for the public hearing?
I wasn't there yet. I wasn't at the hospital.
Any of the panel?
I don't recall. I know there was probably some discussion about the USDA loan, and we may have come before the legislature regarding that. Yep. And that was a lot of that was all prior to COVID and prior to the Army Corps of Engineers assessment.
Right, but we did have a public hearing. L&D was important then, and it's 6 years later, and are we saying the not flushing toilets and the leak are no longer a problem, and we should leave L&D alone?
We're constantly maintaining L&D OB ward nursery. I mean, it's a constant maintenance issue. I mean, and we did do renovations in the OB ward. The rooms, we did a wall hardening. We did a mitigation wall hardening of the OB ward. Part of that included the L&D on the backside. So we did upgrade all of the rooms. We provided them all new beds. So it's not like we haven't been doing anything. We've certainly not ignored it. Can we do more? Yeah, I'm sure we can, and I'm sure we will.
So if you had an additional $10 million to do something like that, you would take it?
Again, I think what we've been trying to say is, we're trying to roll out CIPs in a priority manner, and in a way that doesn't disrupt. At the same time, we're providing patient care, and so that has to be done in a very strategic manner, and so that's why we're trying to do this in a prioritized nature.
I agree with you, and I think the quickest way you can get that fund is through ARP money. Okay, this money that we're looking at for the L&D, again, if it's available after the audit, we don't know what the money is available after the audit. It may be just a few $1 million, or maybe a little bit more. We're just trying to prioritize that at this time, and this isn't until after the election, way after the election, right? So in the meantime, if this is important to you, I would be fighting if I was in your situation with the current administration to say, hey, give me some of that ARPA money. If you really need it now, saving this, killing this, is not going to get you it as the urgency that you're telling us that you need these CIP programs taken care of. That should come from the administration now, and that's what I'm trying to put. I'm not discounting that your priorities are not your priorities. I'm glad they are, because we were fighting for that since the 35th, and it got shot down. And now we had this opportunity to look at something for birthing mothers, right? Now, does the maternity ward bring in finance to the hospital? And can you expand on that, please? And give me some numbers, if you don't mind, please.
I don't have the numbers, but yes, we do have billings and charges for patients that come into the L&D and the OB ward, absolutely.
Okay. Some say there's like 6,000 mothers that come through a year. Would that be plus or minus? Does that sound accurate?
About 264 births a month is what we are seeing, in what we saw in the last year. So it's an average of about 264 births a month is what I was able to get that figure. But if I could add, also respond to the ARPA fund, I need to circle back to DOA Director Ed Byrne, because in the final ruling, in terms of the use of that ARPA fund, there are some conditions and some limitations. So I will circle back to DOA Ed Byrne.
I appreciate that, and I understand from the governor's argument, she was able to convince the federal government to build a new hospital, which she had to convince. So I think we can also look at that for urgency of the hospital. That argument should be, by Mr. Byrne and for yourself, can be, I would say, well received, from my point of view, to easily convince, if it's not specified directly in the final guidelines, that it can be easily preserved. If we're going to tell federal government we want to build a new hospital, that wasn't part of the plan. Why can't we tell the federal government, hey, I just want so many million to fix my panel. I want to move my water. I want to do these different things. But I agree with you. Thank you for working with DOA Director, and I appreciate you working with the administration, the current administration, to resolve this. But thank you very much. Thank you, Madam Chair.
Thank you, Senator Moylan. Senator Duenas.
Susan Mossy, Madam Chair, and thank you to the panel that's here. I want to preface my comments by saying that that's exactly the reason why when LEAP was proposed and this power credit was proposed, I was arguing against it, because now we're in the tail end of appropriating additional revenues, and now we're into audited financials, and we've been ticking down the clock of what the funding's been available for because we didn't use ARP funds for that. So moving forward at this point now, Mr. Kando, I have to go back to this. Even before you talk about the 2020 date, wasn't there a complete assessment under HMAT that was done of all of the projects to be done in the hospital, even as early as 2018?
Good afternoon, Senator. Did you say HMAT?
Yeah, I remember Will Castro, Special Assistant to Governor Cabo, before he came in and did an entire assessment with your team. And I remember that being presented in senior staff because I was there. And it was inclusive of the Z-Wing and multiple projects to include the panel and other things that were identified as priorities for the hospital. Would you say that's accurate?
That's correct. I believe that they were assessing, at that time, they were assessing what we needed to develop, upgrade at the hospital if we were going to stay there. And so, I mean, we've moved on since then. I mean, since we had the Army Corps assessment, that it's not going to be cost effective or feasible for us to stay there. We need a new hospital. So now that we know and have made a decision to move, design and build a new hospital, we're picking and choosing what we need to sustain GMH, for the next 5 to 7 years or whatever. And so that becomes a very selective assessment as well.
And that's my point, Mr. Kando. We are now in 2022. And it should have been the combined CapEx programs when we decided that we're going to build a new hospital of all the immediate stuff that needed to be done to put forward. In fact, going back to Lillian, we actually had appropriated from this legislature, I believe the speaker in 2018 or 2019, the $10 million to take care of the envelope or any other associated CapEx. And was that $10 million ever expended on those projects?
We never received it, Senator. Thank you for bringing that up, but we never received the $10 million because there was no, according to what I was informed, there was no funding for that $10 million. So we never got the $10 million.
Okay, so I'm here to give you some good news today. Because earlier in the year, or early in this budget session when we opened up, the public auditor came before us and he sat right here in these chairs and said that any appropriations, unless they have been repealed prior, are active appropriations. So you actually have 10 million available to you because the law was not repealed. So that is available as well. And this leads me to basically my final analysis of this. And yes, I did put my initials on this particular amendment for the OB ward. And the reason why is because, as my good colleague earlier just said, it is going to be the audited financials. And that is going to be sometime probably in June of 2023, when there would even be a realization of these funds. And the idea here is to identify the priorities, not the priorities before the electrical panel, not the priorities before the envelope to make sure that the flooding doesn't get controlled, not the priorities but the priorities that are alongside and a list of priorities to be done. Because I think that at this point, looking at the years and the span of years it's taken us to get here, we should bundle these projects and do whatever we can through financing and use these cash appropriations to complement that. That is one of the best ways to do financing and the genius ways. As a matter of fact, going back to the reason why it's taken this long to get to the OB ward is because there was all this financial mumbo jumbo that was happening and the inability to have the matching funds that were supposed to be obligated in order to pull this off. So we're here because we did not find a way to finally get the priority and put this project together. So with this possible $10 million, it can finally find the matching funds to going forward and doing a mass appropriation for all of the identified projects, and yes, do them in priority. But if you have the funding there and you have the ability to go out and put this out on a financing mechanism, at least you have resources that are identified. So, Mr. Cando, would that be possible to bundle these programs so that we can finally just settle down and get these things funded? Because in your most optimistic of times, Mr. Cando, and I'm glad you're optimistic, but I don't think it's going to be 5 to 7, maybe 7. I think it's going to be beyond that. We're going to be there for a while. And I really think we need to just make a decision to bundle these projects, get the financing going, and get it done, to include the OB ward. Can you comment on that?
Thank you, Senator, for that information. We have been bundling the projects. As a matter of fact, I mean, you have to consider all the projects that we've actually been completing during COVID that are projects listed in the Army Corps assessment. We're actually quickly approaching 50% completion of the projects identified in the assessment. Of course, you know, the main panel and the subpanels, that would go a long way. That would probably get us to about 70, 75%. There's just so many projects, and we've identified shortfalls of all these projects that we're still trying to seek funding for to get us there. So we're well on the way. We haven't been sitting on our laurels, and we know exactly what we need to do, and we have prioritized them. So that's why I'm very optimistic, because we've been working on it.
Well, that's good news, Mr. Cando, because as the public auditor said, without repealing the law prior, you have $10 million available now, if it's the priority. And now you may have another $10 million available. And so the bottom line is that would be from audited financials. This is not going to put the government in any type of deficit, because you cannot go into a deficit if you spend money after. I'm sure our good friend Yuka knows that. You know, that money is going to be good as gold. And Yuka used to work at the public auditor's office too, so I'm sure she's glad her former boss has identified on the record that any funding that has not been repealed is currently available for appropriation or to be encumbered and to be transferred to any institution if it is the priority of the administration. So going forward, I just wanted to make one more comment, and that is, I do understand the purpose and the discussion on the specialties. I just believe that should come in a budgetary plan, and that's just my feeling. But we'll look at what you currently have, Lillian, and see what the possibilities are to that. But for CapEx, as far as I'm concerned, if we have a plan, we should move forward. It's Masi, Madam Chair.
If I may comment on those specialties, not all specialties, such as the cardiac thoracic surgeon, is viable to have it on island, but we do need it. It's just that the volumes are not there. But maybe what we can do is explore an affiliation with like Dr. Noel Conception to then also come back every now and then and do some of these open heart surgeries on the individuals that need it. And so, but before we even do that, our infrastructure, such as in the operating room, needs to be upgraded. And so that's something that we need to work on. And, you know, in doing that, we have to go through a procurement process. And you know, the procurement process is really a very complicated, very antiquated. So if I may just pitch in, can this legislature, the wisdom of this legislature, look at that procurement, the regulation and the law, and see how it can be simplified and more effective and more efficient? Thank you. I just wanted to plug that in.
Thank you very much. Senator Torres.
Thank you, Madam Chair. I just wanted to thank the panel for coming down on such short notice and providing information. I think what you're discussing generally with all the questions that are brought forward are very useful and I think very timely to have some explanations to what has been a lot of noise in social media lately with regard to the hospital. And oftentimes you don't have the opportunity to explain or defend your position. But I think we all acknowledge that any additional money will not be turned down or will not be refused, and there's no scenario where you feel that you would have enough and not need enough. But what I do support with public health and the hospital is your alternative solutions to filling those gaps, whether it is through telemedicine or consultation or some contractual relationship with experts going forward. And my understanding is that is an ongoing effort with the hospital, right, with regard to your gaps in the provision of services or specialized services. That is more the trend right now?
Through telemedicine, yes, but it's still boots on the ground that we would like to have, such as I mentioned earlier, cardiac thoracic surgeon, if they can come on a rotational basis or even maybe every quarter or every 6 months they come out and they do open heart surgeries. But again, it's our infrastructure that needs to be upgraded. So yes, ma'am.
Okay. Well, thank you. I don't have any further questions. I think the body has exhausted a lot of the concerns that I had also on my mind. But Sizuz Maasi for being here.
Thank you very much, Senator Torres. Senator Nelson, questions for the panel.
Wow. Thank you for being here on such late notice. I didn't think these two amendments would be super contentious. But so just to give you a background of why we're looking to give money to GMH for the hiring of specialty doctors was, I believe it was August 19th, that we saw in the news doctors coming forward saying, we need specialty doctors. And many times, at least during my time here as a public servant, we rarely discuss this matter, right? And when I was asking around the doctors, what is the issue? Is it because there's not enough population for these specialty illness, for the specialty doctors to come to treat these ailments? Is that why the doctors aren't coming? And they said, no, it has nothing to do with population. It's about cost. And Guam doesn't have, or, we don't have the, basically we're not willing to put up the cost that requires to hire these specialty doctors. And so I said, okay, so what can we do? So then an amendment passed earlier that kind of opened the door for these excess revenue funds. And we said, okay, let's capture this money, because we know specialty doctors will cost a lot. But we also don't want to make it where there's no flexibility. And so we wanted to ensure that we can hire specialty doctors. We wanted to ensure that GMH had the authority, because essentially these would be the doctors treating the people in the hospitals. And if they want to go out in the clinics, that's fine as well. And we also wanted to ensure that there's flexibility to hire other doctors that we do not foresee, but also not just doctors, but also other specialty areas like x-ray technicians, nurse practitioners, etc. Nurse practitioners are like doctors essentially, right? And so that's where this amendment came from. And I know I did not discuss it with you, It's been a crazy budget month. And so, you know, I was looking forward to this dialogue. I was looking forward to seeing really what the input would be if we, in this one budget, because I don't recall any other budget, perhaps, during my time here, I don't recall us setting aside a specific amount of money to hire specialty doctors and to see, do we really need specialty doctors? And now we're here today, and we know that there is a lack of specialty doctors. We've seen it within the generations, decades of our families having to leave island to get treatment. And one of the arguments is saying, how do we sustain it? And, you know, Ms. Posadas, you said that this is also can be a revenue source for sustainment for the doctors to stay. And if it's just the argument that I don't want to fund this because there's no guarantee to sustain it, then my argument would be that are we going to wait a year or 2 years to try to tackle an issue while there's people today that need this type of specialty care? And I do respect all the work that you've done, especially in other clinics, bringing in doctors from the States, providing care for those with specialty illnesses, and addressing that. But what we're looking is to have a continuum of care. And many times families that leave off island, it costs them just $20,000 just for expenses alone. It doesn't include the cost of treatment, which far exceeds $50,000 into the $100,000 amount. So really, it's how do we help our people and what can the government do for them? And so I just want to ask, just bottom line up front, does GMH need specialty doctors, and will this provision help them to hire and recruit specialty doctors? And knowing that, also that we see this revenue coming in later in the year, you know, will you be able to develop a procedure to ensure that these doctors are legitimate doctors, that they're good doctors, and they're quality doctors to care for the people of Guam? Thank you.
Thank you, Senator, for that, and thank you for proffering this amendment to give GMH and maybe perhaps even public health some additional funding so that they can also recruit their own doctors and nurses and healthcare professionals. But certainly, yes, this $5 million is going to help, and you're right that we need to find ways to sustain it. And that's, as I mentioned earlier, that when we do recruit the additional specialties, that can then augment, enhance some of our services, expand it to even provide outpatient services. And with the outpatient services, we have a higher rate of reimbursement. So we can generate some of that revenue to then hopefully sustain it. We do have a process in place already in existence where we vet these physicians when they come on board or when they're looking to work in Guam or Guam Memorial Hospital. We have the medical staff credentialing office that looks through all their documents and their licensures and their credentials and making sure that they have background checks. And so that is the process that has already been in existence, and so we go through that process for those physicians. With nurses, the licensure office looks through their background checks and the fingerprinting, court clearance, police clearance. Those are all the security measures to ensure that these individuals are not fraudulent individuals, that their licenses are, you know, definitely valid and current. And so those already are in place to then, you know, look at these professionals, these doctors and these nurses. Likewise, for other healthcare professionals, respiratory therapists, radiology technologists, they go through a credentialing process. So I hope that answers your question. Did I miss one?
No, so just to be clear, this GMH will be able to act on this, and this will be beneficial for the people of Guam.
We can act on it, yes, ma'am. And yes, it is going to be very beneficial for the island of Guam, especially if we also work with public health to help them get, because a lot of these services does not necessarily have to be in the hospital, inpatient, but it can be provided out in the community, and public health is one of those venues that these individuals can go and get follow-up care or even primary care, preventive care.
Okay, thank you. And that, you know, I appreciate the collaboration between GMH leadership and public health, because this is essential that there's a unity, especially when it comes to the health care of our people. And so yes, absolutely, I understand there's an amendment that is going to be proffered to move public health forward, to include public health in this amendment, and I would support it. There's also been talk about doctors anticipating exodusing GMH. What are we going to do about that?
We are already doing, we're constantly recruiting for doctors. We're using, recruiting agencies such as the Global, and they bring us doctors who are here, for 3-month tenure. And so we are aware of doctors retiring and exiting. And so that's a revolving door, constantly doing recruitment and retention. Likewise for nurses, likewise for healthcare professionals.
Thank you.
Thank you, Senator Nelson. Your time is up.
Are you sure it was for 5 minutes?
Yes, it has been 5 minutes. Speaker Terlahi, you are recognized.
Thank you very much to the panel for being here and answering our questions today. It's kind of confusing because we only have one floor amendment actually on the floor right now. That is to increase the appropriation to the hospital by $5 million and for the hiring of specialists. That's it. But we're talking about funding a labor and delivery. We're talking about funding public health. Those are all floor amendments that actually haven't been proffered yet. But on the hiring of specialists, I love the idea of hiring specialists at GMH. Of course, if specialists in particular are going to save lives on Guam, I do not understand for 1 minute why we haven't hired them already. And the fact that we're saying today that we can implement it, implementing is not a problem, it's getting the funding. That blows my mind, to be truthful, because funding for GMH I think is available, right? Especially if you said that's our priority. We're going to fund medical professionals, and we are going to pay whatever it takes to get these specialists on Guam because these are critical needs. We've actually had oversights hearing regarding the hiring of, and the issues came up, not by me, but others, the hiring of non-medical professional above step when we have a critical need for medical professional and specialists, right? In different oversight hearings, we've talked about the authority of GMH to hire medical professionals, how GMH has special statutes in place, giving them the authority to pretty much contract at whatever levels they want. And you committed to that. You assured us that that is the case, that you are able to do that. And the board is able to authorize those types of hiring. We even brought it up at the budget hearing. We asked about specialists. Even before this article about the lack of OBGYNs came out, we asked you at the budget hearing about specialists. And so I have a transcript here that says, you're talking about, you had just been talking about the list of capital. I had asked about the list of capital improvement projects, and you talked about the grants that you were going to receive to take care of that, pharmaceutical fund revenues, and you said, yes, combination of those as well as some of the stimulus funding that we've been receiving. So I asked, stimulus funding, right, okay, and then, all right, I just want to know, we've increased the cost of medical, the hiring of medical staff, right? Would you say then that the specialists that we need, you have been able to procure, and you will be able in FY2023 to procure? And the answer was, we procured some of them through the telehealth, telemedicine, yes. And I said, all right, but the funding is not an issue to procuring specialists, right? Because you have the funding and you have the flexibility in the statute to contract with them in whatever amount you see fit. And the answer was yes, on a contractual basis, yes. And so again, like you said earlier, you didn't ask for this funding. At the budget hearing, even when prodded on it, you did not ask for additional funding for specialists and said you were going to be able to take care of what we needed in FY23 with budget requests. But still, if we need it, I say yes, put the money there, if we can get the specialists, right? But it was always our understanding, based on the answers from GMH, that you are trying your hardest to procure specialists for Guam. That you are not saying, we have an impediment, we don't have enough money, that you are continuing to try to hire specialists. Because if we are doing anything less, and that's what we're saying today, I'm shocked. And I feel a little, betrayed that when we think you've been going all out to hire the specialists that we need, that you're going to come and say, we haven't because we didn't ever had enough money, right? So I think, I'm just hoping that sounds sometimes like what's being said, but I'm going to give the benefit of the doubt that that's not really what we mean. So again, this was not a request made during the budget hearing. It was assured to us during the budget hearing that they would be able to hire specialists. When the physicians on another bill were up in arms and saying that if we hold them accountable for malpractice, that we would not be able to recruit specialists. Well, I asked GMH, then why doesn't GMH recruit the specialists that we need? Because under GMH, these physicians have this immunity. Their liability is capped. And it seems the perfect opportunity to bring in specialists, cap their liability, make it more attractive because their liability is capped, that's one. And of course, the issue is whether we actually can get these specialists, right? And I read an article by Annie Berdalia, who's your medical director, saying the issue is not, that we haven't been trying to get an OBGYN. The issue is that there are no OBGYNs to bring to Guam because there's a nationwide shortage of them, and we're trying to compete with the entire nation. And if we give all the money we can, we still are facing other issues, right? Like what the Army Corps of Engineers pointed out to be labor and delivery equipment that was necessary, NICU equipment that was necessary.
Thank you, Speaker.
Like
your time is up.
Oh, okay.
Thank you.
Thank
Okay, that completes the round of questions for the panel. I'd like to thank everyone who came today, Department of Public Health and GMH administration.
Just, Madam Chair, forgive me, but I believe that this was for the GMH panel is for the this amendment, the specialist, but also I believe that we would entertain the other amendment. the
We'll
labor
take a
and
moment's
delivery.
recess.
Thank you.
the Committee of the Whole is back from recess. We will have an additional round of questions if there's no objection. So if anyone else has another question, okay. Start with Senator Moylan.
Actually, thank you, Madam Chair. Actually, not a question, but I'd just like to make a motion. I respect, of course, our panel here, and their information they have provided is very insightful, and I thank you very much, and I appreciate the good work that you do. I also understand we have another gentleman outside, Dr. Thomas Shea, who would like to join the panel here, since he is the chairman of the OGBYN, I understand, for GMH, and has spent many of hours in the labor and delivery ward. I think his information will be helpful for my colleagues here to ask questions in addition to the information that this panel has provided. So I respectfully request to allow Dr. Shea the opportunity to join.
Excuse me, Madam Chair.
There's a motion on the floor to bring in an additional panel member. On the motion.
Madam Chair, I'm going to object to that motion. We're talking about funding for Guam Memorial Hospital. It's not going, even though Dr. Shea will probably benefit, with a brand new OBGYN or a ward, labor ward, but this is funding that's going to Guam Memorial Hospital, and there's even amendment talking to Department of Public Health and Social Services as well. So I don't see why we should bring in someone that is not part of this panel. I mean, these are the ones this panel here is the one that answers the questions. I don't see why we should, so I'm objecting. I don't think we need to bring someone else in. This is a panel, we ask all the questions. If you want to know how many births there are at Guam Memorial Hospital, Lillian can provide it. You want to know what is happening at the Guam Memorial Hospital with regarding to labor, the labor ward, Lillian is here to answer that.
Okay, there has been an objection. All those
Point of information, Madam Chair.
Please state your point of information, Senator Moylan.
It may not have been clear enough, but Dr. Shea is the chair at Guam Memorial Hospital, OBGYN. So and by the way, he's just outside the door. We won't have to spend any time asking him to come on in. So his input and his experience working out of there, I'm sure that every hour of different hours of the day or night could be very insightful for our discussion in funding which we want to provide to GMH.
And
Thank
point
you.
of information too, Madam Chair, if I may, if Dr. Shea was needed, I'm sure the director of Guam Memorial Hospital would have called him in if it was needed, that any of the questions that we have, she can answer, and her staff. Thank you.
Point of information, Madam Chair. This panel was invited by the senators, just like I'm inviting Dr. Shea. Thank you.
Thank you very much. Thank you very much. There has been a motion and an objection to the motion to bring in Dr. Shea as an additional panel member to the discussion in the Committee of the Whole. All those in favor of bringing Dr. Shea into the panel, please raise your hand. All those in favor. Motion fails. If there's anyone who has an additional question for the panel, we'll start with Senator Taitakwi. You have a question?
Thank you, Madam Chair. It was brought up earlier. Are we still, Madam Chair, on the amendment of? Oh no, never mind. Go ahead. Go ahead.
We are still on the same amendment. This is a round for an additional question, one additional question for this panel, so that everyone can finish up.
Don't clock me yet. I just wanted a clarification, Madam Chair, if I may. It was brought up earlier that we were talking about two amendments as we were doing our line of questioning. And I just wanted to make sure that we are doing this second round based on one amendment that was proffered by Senator Nelson, and that we are going to have that same opportunity for the next amendment to the bill regarding the labor ward at Guam Memorial Hospital. Are we going to have that opportunity as well?
My understanding is that this panel will be dismissed after this last round of questions. So if you have a question for them, please ask them now.
Okay, for both amendments then that are the one that's on in front of us and the potential one coming up. Okay.
Yes, questions now are for both amendments. So if you have any question for either amendment, please ask it now. This is the final round.
Well, thank you for that so much for the clarification. And again, I thank GMH for being here as well as Public Health for being here and answering our questions. I've asked many of them already early on. And most of it is just to clarify again with regards to the priority, the critical areas at Guam Memorial Hospital that needs right now. If you were given $15 million right now, what would be that priority?
As I mentioned earlier, it will be the electrical panel because that will benefit the entire hospital.
How about accreditation?
Accreditation, we do already have that budgeted, but definitely it can help with accreditation, absolutely. And so they go hand in hand in terms of the electrical panel and the accreditation.
Okay. Now, I asked earlier about the labor ward, and my concern is that, you know, when I did ask the question, how or what are you doing now to continue, you know, looking forward to looking at renovating that particular maternity ward, which I think is very important. Don't get me wrong. You know, I mean, other than what someone has said earlier on Facebook that I could care less for mother or children, that is obviously not true. Not true at all. Because I took enough time to research on where the original bill started from, and then the second bill that increased the money amount, and if I'm not mistaken, it'll probably have another increase, because that $9 million was estimated back in 2018 for the renovation of the maternity ward. So we're now looking more, I would say about $12 million. Is that correct? If you were to try and do a guesstimate on how much it'll cost for the maternity ward today.
Possibly, yeah. I'm not an expert in engineer, but, you know, with everything going up, you know, that possibly is the amount that, you know, could be the price tag for the renovation of the maternal child health area.
Well, I'm hoping that if there is a public hearing regarding this, the maternity ward and the needs that are obviously needed to repair that area, there's a bill that's having a public hearing in about a week regarding this area, and I hope that you'll be ready and prepared to make your comments and statements on how we can move forward in making those desperately needed renovations to our maternity ward. And other than, I don't think there's anything else I have on questions. I just made some comments again. I thank you for all your hard work and having to endure, especially with these heavy rains, the situation at the hospital right now. You know, it's not just the patients, but it's the staff I'm concerned about. You know, the dangerous areas in the hospital that they have to deal with on a daily basis. And it's something I think we need to address right now. And if there is some funding, which some of my colleagues think there is, then I hope it goes toward that so that we can move on to the other areas of the hospital. Okay, thank you so much.
Thank you.
Senator Terlahi?
Madam Chair, I want to just yield my time to the speaker.
Thank you, Senator Terlahi. I've yielded your time to Speaker Terlahi. Senator Perez.
Thank you, Madam Chair. So, yeah, there's a question I have because there's a amendment to the amendment that's being that was drafted, and it was to add appropriations to the Department of Public Health. And so I guess the question is for Director San Agustin. So what would that money be used for? I do like the idea of, you know, wraparound services or that continuum of care, where there's preventative care, you know, education, in addition to the critical care. So what would that money be used for? And especially in particular, you know, Guam has high rates of teen pregnancies, you know, meth use, and the impacts to youth, especially, you know, as it impacts their educational capacity. You know, what happens before the child enters school really kind of can impact their learning capability. And, you know, I'm very interested in addressing any kind of preventive measures that we can do to ensure that when they enter school, they're school ready. There is this notion, or there's this basically a phenomenon, or what's been happening is that we find that in literate, poor households, they're already behind when they enter school. And basically what causes that, or one of the causes of that is, exposure to unhealthy household environments, maybe lack of, proper prenatal care, lack of, sexual education, that sort of thing. So, yeah, there's a lot of evidence out there that shows that the environment in which a mother and a preschool individual or youth, what they experience impacts them greatly. And so, yeah, I'm very interested in that preventative type of care. So how would you utilize so right now in the amendment to the amendment, it's a $5 million. If you can maybe talk about what you spend now, what is the programs that you have to address this need?
Okay. Well, Senator, to your question, currently the way the amendment appears in my read is that it's really for physician specialties, but I'm definitely open to the area for public health and social services to be expanded. That would allow and give me the authority or flexibility so that we can take the funding and take a portion thereof so that we can engage a team that can go out and expand our services with our existing programs. So one of the programs we have is family planning, and we can look at the current scope of work and look at how we can expand those services. So we can definitely take some of these funds to do that. And that would include efforts with working with the schools on sex education classes. And that's one of the areas that we can expand if we are given the authority to hire beyond just specialty physicians. We're looking, and I said earlier, we're also looking to look at a clinical psychologist. We don't have one on board right now. We would like to fund that. But in terms of the school-based outreach and education, we would work with our existing program, Senator, survey which ones would be appropriate and whichever funds we could use here, we could use a portion of so that we can expand our reach into the community and into the school settings. So family planning would be one example of the program that we could use, perhaps even maternal child health, MCH, and then we could look at the other existing programs that we have and partner with GDOE in this effort. Do you want to speak?
Senator Vince Uggan, I'm with the Chief Public Health Officer Office. One of the things too is with the hiring of an infectious disease specialist, we can actually be able to see more patients at our community health center, especially those who are infected with STD, HIV as well as tuberculosis. And so if this money is received, we'll be able to hire an infectious disease doc to see more patients that are impacted by these diseases.
So, yeah, if you can provide a listing of the programs and what would this money be used for, and maybe how much would you need? I guess the plan, we don't know exactly what the plan is.
All right, yeah, absolutely, Senator, yes. So the opportunity for a $5 million expansion of our service is definitely a welcome added on to our current capacities for 2023. But yes, we can definitely put a plan in response to the offer or the possibility that we would receive the $5 million additional for FY2023. And we will list the programs that we would use these funds for to expand the reach.
Yeah, we appreciate that, but we're about to come on the amendment, so if you can draft something really quickly, we appreciate that. Thank you. Oh, so the other question too, so Lillian, so in the amendment it says shall include the following specialist, right? So, I mean, you had mentioned that there are potentially other specialties that might be more needed, or I don't know, if you can explain, maybe talk about which specialties you think would be the most needed in GMH? And, you know, the thing is that does it provide you enough flexibility to seek those specialties?
Just a point of information, Madam Chair. If you read on, it says, but not limited to. So shall include, but not limited to, the specialties.
Thank you, Senator Nelson. Yeah, so the question is for Lillian. So what specialties, can you just reconfirm which specialties you think are, I know you mentioned about cardiac treatment.
We have a cardiologist, but they rotate, 2 cardiologists rotate every 6 months. And so that seems to be working out okay, but you know, when one gets ill, then we don't have anybody. So definitely if we could get a permanent cardiologist on a full-time basis, that would be great. We do need an endocrinologist. We do need someone with a GI specialist specialty. Orthopedic surgeons, we do have a couple of orthopedic surgeons on the island of Guam, and so they rotate through on being on schedule. But, you know, they are also looking at and talking about retiring. Neurosurgeon, we have 1 on island right now. I hear Grmc recently recruited 1. I don't know how, I didn't confirm that information, but definitely we need a neurosurgeon because, you know, we have stroke is pretty high here on the island, and so it would be great to have an additional neurosurgeon. Anesthesiologist, we need 1 or 2 additional anesthesiologists. And as I mentioned earlier, perhaps a cardiac thoracic surgeon that can then we can affiliate ourselves with a hospital or you know, a health system that provides cardiac thoracic surgery, and that cardiac thoracic surgeon team can come maybe every 6 months and do some cardiac thoracic surgeries on individuals who need open heart surgery. Rather than flying them off island, if we can have that on a rotational basis every 6 months, have it available, that will be great to have on board. As mentioned in the amendment, gynecologic oncologists, that would also be very helpful to have on island. Not necessarily at the hospital, but, you know, on island, it would be great to have that. So, does that answer your question, Senator?
Yes, I appreciate it. Thank you so much.
You're welcome.
Thank you, Madam Chair.
Thank you.
Thank you. Senator Brown.
I really don't have too many more questions because I think this whole discussion really should be happening at a public hearing where we could actually get into the depths of discussion, in all fairness to the hospital as well, so that they could provide us, and even more importantly, the public, a status update on where you're at, and then also relate us what your greatest need is. I mean, you relayed the electrical panel. To proceed now doing this at this 12th hour before the election and, you know, trying to get and complete this budget process for the rest of the government of Guam, I think is unfair. It's unfair to you and it's unfair to us because there are other things and other services that we'd like to know what is being provided. And, you know, this short-term infusion of cash, I have no problem seeing it invested in tangible things that we can get that we've not been able to fund. So I don't have a problem with that. I'd rather see that than to go into pay raises and hiring people that we don't know a year or 2 from now we're going to have the money to sustain. But I think to not have that information available and then to do this as if we're doing a question and answer oversight hearing in the middle of trying to complete this budget, I just think is unfair to all parties involved. And while I understand everyone wants to do everything they can, I don't necessarily know that we're helping the hospital or ensuring the best outcome for our community with what their needs are right now. And like I said, I want the nicest car in the lot and the most expensive and the most beautiful, but can our people afford it? And what they can afford, then, you know, let's make sure we can do that to the best level that we can. So I don't have anything more to add. I can't say that I'm going to be supporting these amendments under the guise that by supporting it, I'm supporting our people, because if I don't, I just think we need to have a more organized way of doing this. And here we are in the 12th hour. We can't spend money fast enough. I've never been in a legislature. We are in warp speed trying to spend as much possible money as we can, as fast as we can, to every project that we want to put it on, without really addressing what the real priorities are of our community. So you know, those are my thoughts and my position on this issue, but I do appreciate your efforts for coming down and responding to our questions, definitely at such short notice. But I just think this is an unfair forum to proceed with regards to these issues. Thank you, Madam Chair.
Thank you, Senator Brown. I believe Administrator Posadas wanted to add an additional answer to Senator Perez's question.
Yes, thank you. Neonatologist is also one specialist that we're looking for, and additional pediatricians. We'd like to have more pediatricians in the House. Thank you.
Thank you very much. Senator Ada.
Thank you, Madam Chair. Ms. Posadas, the departure of the pathologist from the hospital, what has that created? Has it created a void that needs to be filled immediately? Is it something that, I mean, how critical was that pathologist that left, just up and left?
It is critical, but we were very fortunate that we have another pathologist who also works at Grmc, has been filling in, and actually he was already filling in when Dr. Abarizik, the pathologist, went on vacation, and then on vacation decided to just resign. So Dr. Alsabam has been filling in those duties and responsibilities, and we needed to make sure that he continues, because that affects our College of American Pathology accreditation, which is the CAP, as well as our CMS certification and our CLIA certification. So we did not have a break in any of that coverage or for pathologists. We had Dr. Alsabam, but definitely if we could get another pathologist, it would be great. But it's not also uncommon that one pathologist services a variety of various number of hospitals.
So then you guys work together, GRMC and GMH.
Yes.
So I know GRMC was just awarded some certification as the primary stroke center. And you
Right.
just mentioned about bringing on a physician for, is that working against each other now, or?
No, they actually work in collaboration with each other. So, it's good to have another neurosurgeon on island because, like I said, stroke is very common on island. And so if one neurosurgeon goes off island, at least we have another one available.
Okay. And then just my last question for the amendment on the labor and delivery ward. If this amendment goes through and it passes, will you guys use this money for the labor and delivery ward?
We will use some of it, certainly, yes.
No, not some of it. It's an appropriation for $15 million from the audited surplus. Will you use the entire $15 million for the labor and delivery ward?
15 or 10?
It's 10 million now? Okay, 10 million.
We'll put it to use.
Okay, all right. That's the only questions I have. Thank you, Madam Chair.
Thank you.
Thank you, Senator Ada. Senator Moylan, questions? Thank you. Senator Dueñas. Senator Torres. Thank you. Senator Nelson.
I really don't have any questions, Madam Chair, but just to thank the panels for being here. And we talk about critical needs and priorities. Well, having healthcare specialists are critical needs and priorities, especially for our community. Some of us don't have the luxury to, on a whim, fly off island to get further treatment. So thank you, Madam Chair.
Thank you very much. Speaker Terlahi.
Thank you, Madam Chair. And I'd like to thank Senator Pito Terlai for yielding his time to me. Very appreciative. So to the panel, in the GMH, again, I love the idea of putting more money towards capital improvement for the hospital. In fact, that's what we've been trying to do over the years, right? And as you testified today, the money was never given to the hospital, $10 million for capital improvement projects. The 3 priorities listed at that time by GMH, the same 3 items listed by the Army Corps of Engineers as well: the repair or replacement of the electrical panel and necessary generator, repair of the leaky roof, procurement of an electronic health record system. All of these, GMH continues to work on. And as you said, the electrical, right, is the priority still today. This is years later. So of course I love the idea of giving money to GMH for capital improvement projects. I want to find out, however, in the GMH's FY23 budget request did not include any request to fund capital improvements or renovations specifically for the labor and delivery ward. There were requests for various medical equipment needed based on the Army Corps of Engineers assessment comprehensive list of medical equipment needed for all hazards and emergency management. That included, and I pulled out ones that looked relevant to the labor and delivery wards, it's portable newborn ECG monitor. Stated cost $40,000. Ceiling lighting system during delivery and laceration repair. Stated cost $60,000. Mobile storage supply carts times 10 to replace carts and store COVID PPE, $60,000. Bedside computers, monitors times 15 to replace breaking equipment for electronic documentation, $75,000. Have these equipment been procured or acquired already by GMH?
With the electronic health record, that's an ongoing project, and we have been funding that via our operations revenues, and so that's ongoing. In fact, we're going to go live in October. So that EHR project, which is a priority, because we needed to transition from the old electronic health record system. The roof repair, as Mr. Kando mentioned, it is ongoing, and the funding, we receive funding through the governor's help. And other equipment that you mentioned, I'll let Mr. Kando speak to that.
Yes, Senator Tulahi, as I had mentioned earlier, we had about $2 million in DOI funds that were specific to the MCH units, the L&D, OB ward, and nursery, and we've procured all of that equipment. I'm not sure if we've received every single piece yet, but I know the procurement, most of it has been procured. There still may be some outstanding, and we're still in the process of liquidating those funds.
All right, thank you. And so the Army Corps, in its assessment, did point out kind of improvements that were required for the labor and delivery to bring it up to standards, right? These are structural or layout, right? They talk about layouts, which sound like expansions, and some other different things. And so they put them as part of the list. However, when they made their executive summary and they listed the major items of infrastructure concern, in other words, when they prioritized what had to be done immediately so that this hospital can take us through the next 5 years that it's going to take to build the new one, that was the premise at the time. They did not put in this list particular repairs for labor and delivery. And so you've talked about the priorities that they had. And I want to commend GMH. I've been very impressed with the resourcefulness of GMH in finding ways to fund these capital improvement projects, including their revenue, including ARP funds and other funds. And during COVID, they were able to retrofit and do all of that structural repairs that were needed to get through the COVID. And so I commend you for all of that. And I remember asking in particular, well, what about this project? How are you going to fund it? And you always seemed very optimistic that you're going to fund that through, you're going to find a way. It's either through a grant. I'm sad to hear that the one grant was refused, but I have no doubt that you're going to continue to find ways, and that the governor has at her disposal transfer authority to give GMH whatever it needs to, and she's done this. So, of course, to fund whatever is a priority. And I guess the only debate on this amendment, if, to fund the labor and delivery, is that I'm a mother, I have 3 daughters, I don't want them to be delivering in a substandard area. I want them to have the best experience possible. And so yes, of course, we love the idea. We all support that idea. I don't think there's anyone in here who would be objecting to that. The question is, if we have a leaky roof that's not fixed yet, if we have an electrical system that is a hazard, if we have fire hazards, the Army Corps lists a whole list of things that sound horrible, really, and that they propose high risk to the patients is really the biggest problem. And so I think we all agree, give the money to GMH, especially for capital improvement projects, especially those that would give us the best patient outcome. And I just hesitate to dictate for GMH what its priorities are at this point, although it is frustrating to take years and years to get some of these priorities done, right? And no one expected COVID again. You were right in the middle of doing your transition on your electronic health records when COVID came in, and I know that that delayed it. So we're very much looking forward to the October opening. But if this money, if we have $10 million extra from excess funds from FY22, that's this current fiscal year, and we're able to give it to the hospital, do you want it to be designated for labor and delivery, or do you want it to be designated for capital improvement projects in general, or are there others that you want it to be specifically listed instead?
As the administrator of the entire hospital, my responsibility is not just one area of the hospital, but the entire hospital. So really what is going to be in the best interest of the entire hospital. Yes, I recognize that labor and delivery needs some upgrading and needs some construction, and maybe we can do some construction and not really the full construction and renovation, because we are going to move forward towards building a hospital. But really what's going to benefit the hospital is the electrical panel, the infrastructure, the IT that we're challenged with. So those are the things that, my responsibility is what I'd rather do with the money is the overall need of the hospital. And if I may again plug in, the reasons why a lot of these projects took so long, because again, the procurement process. It takes long to really try and get some of these procurement of equipment. I mean, right now, we've been trying to get the angio suite that is outdated, that keeps failing on us. We're trying to procure that, but it's taking us 1.5 years to almost 2 years to go through that procurement process to get that. And we're still kind of not really, I think we're only about 80% through that process. So if I may plug in, please take a look at that procurement law, because that's a very complicated and very antiquated procurement that really is not efficient, not simple. So thank you.
What exactly is your delay in the procurement? Which part of that process? Is it writing up the specs? Because that's a project that was proposed since the prior administration. They were asking us for funding for an angio suite. So what part of that project is, where are you stuck?
It's the back and forth with the Attorney General's office in terms of specifics, and you can help me here, remember what the details are, but it's already close to 2 years trying to get that angio suite procurement. It's just such a cumbersome process.
Yeah. A lot of times, agencies come and talk about our procurement process being obsolete, lengthy, burdensome. And when we, pursue that with GSA, OPA, AG, the answers we get are that it's the specifications, right? And that's the back and forth. It's how are those written? Who's writing it? Are we saying angio suite? Or are we saying, we need cardiac services? Anyways, I'm not going to speculate what the issues are, but I'm just saying that's sometimes what changes maybe between one administration or the other, even between one staff member and another, is like what we want to include and not include in those specifications. But you have been successful in many of the projects, so I think you have been able to find your way quite successfully through many of these procurement, large ones, including the EHR, which was large, and the repairs. All right, so you've told us your priorities for improvements to the hospital in general, and these are critical to healthcare, to the provision of healthcare for the patients. Yes, you're nodding your head. Yes.
Yes, ma'am. Yes, Senator Speaker. Thank you.
All right, and All right. What is the, and then I read an article that talks about, I mean, we all followed through. When I was first elected, we saw the timeline. I've got like 4 pages of the timeline of the labor and delivery, right? So at different areas, you know, we have failed to move forward. And I think there were so many efforts to keep trying. Financing at the, you know, the one of the banks wouldn't give us the advance financing, right? That was required by USDA. That's pretty much where it left off. But this administration, to my knowledge, and the Board of Regents, the Board of Trustees right now, has not pursued labor and delivery renovations as per those prior laws, because of the other issues that are presented to them. And I'm very grateful for the Army Corps for laying out priorities for us and showing us very concretely that we need to fix these, even if we are going to build a new hospital, right? So that's been our premise here, and yours as well. And so I would like to see those completed. If we gave the 10 million and you used it towards what you believe the priorities are, how far would that 10 million go? What would you be able to accomplish?
It wouldn't go very far. I mean, it's not even enough for the main panel and subpanels.
For the what?
The main panel, subpanels, and 1.6 meg. It's a package
electrical
project.
panel.
So, yeah, so that's we're talking $12.5 million. We have a list of projects that we are yet to accomplish, as a part of the Army Corps list, and we're seeing a shortfall in its entirety. We're looking at about $30 million,
right,
which is inclusive of the $12.5 million for the main panel.
For the electrical panel,
Yeah, about
12.5 million.
About
And
30,
this
30
would cover.
million, and that doesn't even include the Family Birth Center, the L&D, OB.
I'm sorry, the what?
The MCH units, the project that we've been talking about at 9.5, now it might be about 12.5. The shortfall that we're calling at 30 million doesn't even include that project.
Okay. All right. And do you have any of the funding for that 12.5 million project? None.
No.
All right. And it's ironic because one of the when we passed that bill in the past for the 10 million, that was for that as well. And the governor, it was lapsed into law, but in her message she said she wouldn't sign it because it wasn't enough, right? The 10 million was not enough. And this 10 million, not enough either, but have you set any money aside for that project? For the electrical panel? Yes? Any money? Yeah.
Sorry, what was the question?
Have you set any money aside from any other sources towards that project?
No.
Electrical panel?
No, Senator July.
None. All right. So the most, perhaps if we give this 10 and we are able to acquire the 10 that you were appropriated back then, not yet received or given to you, that's at least 20, and part of that panel maybe. All right. Is the procurement complete on that? In other words, do you have the specs and the RFP or IFB ready?
For the electrical panel?
Yes.
No, ma'am.
We have a set of designs. Of course, those are expired. So we have an engineer of record that we would bring back to the table to reassess and to recertify, and then we would be in a strong position to include the specifications as well to then proceed with an IFB.
Okay. Thank you very much. Thank you to the panel. Thank you,
Speaker.
Madam Chair.
Thank you, Speaker Terlahi. Thank you very much to all of our panel members for your time this afternoon answering all our questions. We will take Senator Blas did not get to ask a question during his turn. Okay, apologies, Senator Blas. We will take a brief recess to release the panel. Sidzius Masi.
Committee of the Whole is called to order. Before we recess for the panel, Vice Speaker Tina Munoz Barnes addressed that she will be proffering an amendment. The amendment is in. So, Vice Speaker Tina Munoz Barnes, ma'am.
Mr. Chair, for giving me the opportunity. This amendment is to the amendment as proffered by the good senator from Jericho or Jigo. It is on page 137, line 10, the TMB to TCN amendment SB 27610 L10P137. And it would read to amend the amendment to read Section 33, Authority of Guam Memorial Hospital, then underline, and the Department of Public Health and Social Services to recruit and hire long-term specialty doctors. The sum of $10 million shall be appropriated from the audited surplus revenues from the fund balance of the fiscal year 2022. $5 million is hereby appropriated to the Guam Memorial Hospital and $5 million to the Department of Public Health and Social Services, authorized for the purposes of the recruitment and hiring specialty care physicians that provide qualified advanced care for diagnosis and treatment that shall include, but not limited to, gynecologic, oncologists, autoimmune specialists, urogynecologists, gastroenterologists, and maternal fetal medicine specialists. Guam Memorial Hospital Authority and Department of Public Health and Social Service are further authorized to negotiate salaries for physicians beyond the present pay scale and shall submit a hiring plan to the legislature. And then, of course, Mr. Chair, to ask legal to renumber and make any technical corrections as necessary. And I do this, Mr. Chair, that based on the discussion, the indisputable need to ensure that we proactively address the need to provide access to health care in both GMH and DPH, Department of Public Health and Social Services statements, I have this amendment. And simply put it, Mr. Chair, it addresses the inability for Department of Public Health and Social Services to make hiring more attractive for physicians, especially given the burdensome process, and it doubles the amount to $10 million so both GMH and DPHSS can provide the much-needed healthcare expertise for our people. And Mr. Chair, I can go on about why this benefits our community, but I'd be repeating what we all just heard, and I know everyone here knows that we need to improve the choices for our healthcare for our people. And one thing that was also not discussed today was that the current cohort of physicians serving our island is already, and I'm going to say that already reaching the retirement age. Mr. Chair, I didn't mean to, age ourselves, but in this arena, they're already reaching the retirement age, as in my classmate shared just earlier as an OBGYN that she will be retiring by the end of this year. We need to ensure that there is continuity of care, and if there is no objection, Mr. Chair, I don't mind adding my colleagues, even the proffer of the amendment, the original amendment, and the healthcare chair, and all my colleagues here as co-sponsors. But because for me, it's really not about getting credit, but by putting our money where our mouth is, and that we ensure that the healthcare is a priority. So I make that motion, this motion, and in all sincerity, we've always talked about healthcare, and I literally can relate to wanting the specialty and expertise here. I can't speak on a personal level, Mr. Chair. I had to leave on an emergency last year because my spouse has a very, very rare disease. It's not curable, and when we had it assessed here, our doctors were hoping that that I could get a second opinion with my family to see that their diagnosis wasn't, that there may have been a mistake, but when we went back, our doctors are great here. They affirmed that the diagnosis was correct, but our island doesn't have the specialty, the equipment, and the full services that it needs to bring to have our island residents get the care they need at its full level. So, call me biased, call me whatever, but I truly see, Mr. Chair, the need for wanting to do this, and we need a lot of specialty care here. And it's always been a vision and a dream that this can really become a reality. And, like I said, our medical community is good, but with everybody retiring out, we need the help. So I hope that I can get that consideration to approve this amendment to the original amendment as proffered by the good senator from, is it Derrida or Jigo? Jigo. So thank you, Mr. Chair.
Thank you, Vice Speaker. Does anyone like to speak to the amendment? Senator Brown? The amendment to the amendment.
Understandable, Mr. Chair, again. I mean, we've all been in this situation. I don't know anyone here, I certainly have. I've had a close family member had to live off island for a year because medical care could not be provided. There's just some realities that we have to deal with because of where we are and what our people can afford. And again, sir, I just really do not think in the twilight hours of this day on Friday, the day before the primary election, that these issues that are so critical and important that we're going to gloss them over and bank on sympathy votes to pass this. Without the specifics, I'm sorry, allow me to speak. Why can't I speak?
Stand by. Madam Vice, you have a point of information? Because
No, there was a point of personal privilege, sir.
there's no reference to anybody here because, as I mentioned, this is something we've all had to deal with.
Sir, you have to address the point of personal privilege.
There is no issue that's personal to anyone here, Mr. Chair. I should be allowed to make my statements because I'm not talking about sympathy in particular for a Vice Speaker's situation.
Wow.
It's just the entire issue of itself.
Point of personal privilege, Mr. Chair.
What is personal? Why can I speak on the floor without constantly being interrupted?
Senator Brown, let me just
Thank you.
find out what's the point of personal privilege, please. Senator Nelson.
The speaker has mentioned already another colleague of ours on the record mentioning sympathies and so forth and so on. It's unprofessional. It's uncalled for.
Excuse me, Mr. Speaker, I'm allowed to speak without this being inferred as if it references anybody specific here.
Yes.
I'm talking in general. As I mentioned, I don't know anyone here who has not experienced this.
Understood. Go ahead and continue, please.
So, if you want to personalize it, that's unfortunate, but that's the very problem that I'm concerned about here at this time, at this day, at this moment. That we're going to make policy decisions in this amount of money that is running out very quickly, that we have no ability to determine at this point if we have the ability to sustain continued funding. Because we want to say now, I want a lot of things too. I'm sure our people want a lot of things, Mr. Chair. Just like we need public safety, just like that poor 20-year-old that got attacked in his backyard over the weekend. And certainly look at what that family's having. There's a lot of issues on the plate that our people need us to address. And I think we need to do it in a responsible fashion. I think we need to have proper information being brought forth before we make decisions with these. I've never in my career in the legislature, now going on 14 years, have ever seen the amount of money we continuously, without reservation, want to continue to appropriate without ensuring where we're going with it or the ability to sustain the funding for our people.
I don't want to say, oh, look at what we're doing, my dear people of Guam, to help you, and then at the other end, our people are left short. This is not our money. To say, let's put our money where our mouth is, this is not our money. And I think we should be responsible, we should be cautious at this time because we don't know what's around the corner, Mr. Chair. And when I look at the fact that our special funds are in decline, which gives me a gauge of where our local economy is, I think we need to be cautious. And what monies we have left, we need to ensure that there's some long-term benefit to our people. We all want to ensure good, safe health care, and there's so much we cannot provide at the most basic level. And at this point, we want to propose everything under the sun. My dear people of Guam, we want to give you all this. And I don't want to make false promises and short-term benefits that have no long-term investment in our people. And if some people want to take that personal, then, hey, our people deserve more than this, especially now at this time. Because, gosh, do you think our people are naive, that they're not thinking we're here pandering to them? Their feelings, their emotions, their fears right now that's going on in this community, they don't even feel safe in, least of all to worry about getting proper health care. I just think, Mr. Chair, we need to be responsible. And on that basis, that's why I'm objecting. It's not that I don't care about our people. They're no more your people than they're my people. They're our family. But we should be responsible in how we address the spending of their money and the accountability of their money. And we should be doing this now as we're trying to wrap up this budget that has a timeline on it and then tell the people we're doing something good for them. That, to me, Mr. Chair, is just not acceptable. And with that, I'm going to object to this amendment.
Thank you, Senator Brown. Yes, Senator Tiger, you'd like to speak to the amendment?
Thank you, Mr.
To the
Chair.
amendment?
Yes. Thank you, Mr. Chair. Everyone in here, I'm sure, has had family. And if it's not their family, it's themselves. Personally, myself as well, have had to leave off island to get care. We're always going to have that situation. Technology actually is coming a long way. We just had a panel sit in front of us today and tell us about how telecommunications is how telemedicine is working for our island. It's something during the pandemic that we've realized that we can do this. Providing specialty care, at least monitoring an individual who doesn't have to go every 2 months or every month to go back to the mainland to be monitored. They could be monitored here. So strides are being made. I'm not saying that this amendment is not important or the amendment itself, the amendment to the amendment or the amendment itself. It is important. These are options that we can look at. But let's do this responsibly. If we're going to start something, we better learn how to sustain it. Guam is notorious for doing things like that. Building a new building and have no maintenance, and then it falls apart after 5 years. So if we're going to do this, let's do it responsibly. Let's have a public hearing. Let's find out from Public Health as well as Guam Memorial Hospital what they already have in place. And if I'm not mistaken, they did mention that they have the ability to bring on specialists if they need to, or bring on new doctors. No matter what type of work you're going in, you're going to always have people retiring out of that career, and the new individual comes in to take over. You're going to always have that. There's no big issue with that. But what happens if we don't have the funding to sustain this? You know how difficult it is to give somebody a program and then take it away? It's even harder to take it away. That's my point. It's just, let's do it right the first time and provide some sustainability to this. And unfortunately, there is nothing in here. In fact, they didn't even ask for this money, Mr. Chair. How many times did we hear from Lillian Posadas where she said, we didn't even ask for this money? They don't even have a plan. So what are we going to do, just throw money over there without a plan in place? equipment, technicians, everything that comes with bringing in a specialist. But there's no plan. It doesn't mean that this is something that we can't look forward to later on when we put this plan in place, and a public hearing will spell that all out. And move forward responsibly. Not, rushing through this, Mr. Chair. So I too stand in objection of this amendment. And I will tell you, I will object to the amendment itself, the amendment to the amendment, and I will object to the original amendment to this. Because we just heard from Guam Memorial Hospital that they need to fix their electrical panel, their subpanel, and their generator, which is about $12.5 million. And Mr. Chair, you and I are doing the tally on how much excess revenue is left over from FY22. I don't think we're going to have enough to cover the other amendments that are coming forward. So let's be conscious of that. Let's not just be so, trigger happy to spend everything we have. We've got to have some cushion here. Thank you, Mr. Chair.
Thank you, Senator Tyree. Does anyone else like to speak to the amendment? Senator Blas. The amendment to the amendment, okay?
Thank you, Mr. Chair. Mr. Chair, recognizing there are already objections to the amendment, I think the amendment itself poses an issue in that, and it should be bifurcated because there's two different subjects on this amendment. One is on the recruitment, the other one's on the retention. The bottom line, one is talking about giving an authorization, and the other one, appropriation, the other one's authorizing a pay scale. Can we take a little break and have legal counsel look at it, because I think this has to be bifurcated.
Let's take a short recess and let's reconfirm that statement. Thank you. Committee of the whole is called back to order after this short recess. My colleagues, we're just going to go ahead and recess until Monday, 8:30. And please, my colleagues, let's focus on hopefully completing everything Monday. All right? So we will recess until Monday at 8:30. Recess now until 8:30 Monday. Please be safe and happy weekend. Thank you.